Hello, everybody. I'm talking about catheter ablation of ventricular arrhythmias. First, definition. Ventricular arrhythmias, when an abnormal heart rhythm comes from the lower chambers of your heart, the ventricles, it is called a ventricular arrhythmia. Rhythms of this type include ventricular tachycardia and ventricular fibrillation. Heartbeats too fast, which prevents oxygen-rich blood from circulating to the brain and body, and may result in cardiac arrest. Catheter ablation is a minimally invasive procedure in which the doctor bends a flexible thin tube catheter through the blood vessels to your heart to ablate stop and abnormal electrical pathways in the heart tissue. Watch our video.
You might find yourself concerned because people tell you, oh, this is associated with sudden death, or oh, you might have to seek urgent medical attention. But I'm going to try and clarify things for you a little bit, both about what this might be and how we might go about treating it. Ventricular arrhythmias can occur in both structurally normal and structurally abnormal hearts. What we mean by this is that there are some patients out there who really have no other underlying heart disease except some abnormality in their electrical system of the bottom chambers of their heart, or the ventricles, that can cause the heart to go out of rhythm. These can appear as occasional extra beats that one might experience as skip beats, or as a rapid array of beats that are occurring all in a row, termed ventricular tachycardia. In rare cases, if the heart is structurally normal, this can actually result in a dangerous rhythm, though again, that's relatively rare if there's not some other underlying heart disease that might be contributing. Now, in some patients, however, they can have an abnormal heart for other reasons. There are a variety of reasons that the heart can become structurally abnormal, such as if you've had a heart attack in the past, if you have some sort of genetic abnormality that you might have inherited from your mother or your father. You might have some inflammatory disorder of your heart, such as sarcoidosis or myocarditis. All of these different syndromes can contribute to electrical abnormalities in the bottom chamber of the heart as well. But sometimes when people have what we call substrate or abnormalities of the normal heart architecture, this can lead to ventricular arrhythmias. And in these patients, these ventricular arrhythmias can potentially be life-threatening. When we look at these arrhythmias happening, however, we have to take a systematic approach to their evaluation and to their treatment. So what do I mean by this? When we talk about evaluation, we're looking to see, is there another reason they happened? Was there a medication you were placed on? Was there some abnormality in your electrolytes or what you were taking for other reasons, such as over-the-counter herbal remedies, that might have contributed to why you might have those arrhythmias, and in fact, they might go away if we do nothing else. We're also trying to figure out how significant the arrhythmia is. Is it something that is life-threatening or is not? Because not all of them are. And then when we talk about treatment, we're looking really at two large areas. In those patients who don't have dangerous ventricular arrhythmias, we're looking to treat to improve quality of life or symptoms. Because some patients can have a variety of symptoms attributable to these arrhythmias, including feelings of skip beats or rapid heartbeats or even dizziness, but some might just feel tired. But then the other group we worry about is the ones in whom these arrhythmias can potentially be mortal. In other words, they can lead to sudden death. In those patients, we like to risk stratify to figure out, are these arrhythmias dangerous? And how do we protect those patients from dying suddenly? The mainstay of treatment you might see if you go online is something called a defibrillator. You might have seen this on commercials or on TV shows where people are running about with these pads, drop them on a patient, and then provide an electric shock. This is what a defibrillator does for those patients who have the more risky ventricular arrhythmias. It sits in your body all the time and then basically gives a jolt of electricity if your heart goes out of rhythm in order to restore it to normal rhythm. But the defibrillator doesn't prevent the arrhythmias from happening. It just is there to save your life in case they do. In order to prevent the arrhythmias from actually happening, there are two mainstays of therapy. If we cannot find another reversible cause, we can either provide you with medications, and there are a variety of medications we can use. These medications are termed antiarrhythmic drugs and tend to be successful in as many as 50 to 60% of patients. However, they can have side effects, and in some patients, they can actually cause more arrhythmias and sometimes dangerous arrhythmias that could lead to sudden death as well. As long as patients are properly monitored and the initiation of the drugs is properly done, however, the likelihood of this is very low. Thank you for joining me today to learn more about ventricular tachycardia. In the next video,
Application in medicine. Catheter ablation has emerged as an important and effective treatment option for many recurrent ventricular arrhythmias. It is a procedure where areas of the heart are electrically inactivated or ablated to resolve an abnormal heartbeat. Watch a video.
With the Norton Heart and Vascular Institute. The heart's electrical system produces signals that control the timing of your heartbeats. Sometimes this system can beat irregularly and cause symptoms of palpitations, rapid heartbeats, or skipped heartbeats. This can be due to short circuits in the electrical system, extra heartbeats, or abnormal electrical connections. These abnormal rhythms are called arrhythmias. Oftentimes, these are not dangerous, but they can become serious when they affect the heart's ability to pump blood or if they are due to another underlying heart condition. Treatment of arrhythmias may include medications or a procedure called catheter ablation. A catheter ablation is a minimally invasive procedure to correct an arrhythmia. Catheter ablation can be performed to diagnose and treat a wide variety of arrhythmias, including supraventricular tachycardia, also known as SVT, atrial fibrillation, atrial flutter, ventricular tachycardia, and premature ventricular contractions, also known as PVCs. The catheter ablation procedure is performed in the electrophysiology laboratory of the hospital, where you will be placed on an X-ray table. You may be given medications intravenously to sedate you or make you sleepy. These medications help reduce your anxiety and relieve your discomfort. Your groins will be cleaned with antiseptic and sterile drapes will be placed to cover your body. A local anesthetic will be administered with a tiny needle to numb the area where the catheters are inserted. You will feel a pinprick and possibly a stinging sensation for a few seconds. Small, thin wire electrodes will then be placed through a vein in the groin. These catheters will be guided to your heart using a special type of X-ray called fluoroscopy. Once in the heart, the electrodes measure the heart's electrical signals and are used to stimulate the heart from various locations to try to induce or start up the abnormal rhythm. Medications are sometimes used to assist in stimulating your arrhythmia. Special software is then used to make a 3D map of your heart and its electrical system to help your physician pinpoint the abnormal tissue in your heart. The catheters are then used to burn or freeze these small areas of heart tissue that generate and conduct the abnormal electrical activity. Upon the completion of the catheter ablation, the catheters are removed from your groin and pressure is applied to stop any bleeding. Following your catheter ablation, you will be moved to a recovery area to rest quietly for several hours. Your heartbeat and blood pressure will be monitored continuously to check for complications. Often, patients are able to go home the same day, but your physician may elect to keep you overnight for monitoring. Be sure to review pre and post documents on what to do before and after the procedure. As always, if you have questions, please reach out to your doctor's office. Thank you for choosing Norton Heart and Vascular.
Well, pros and cons. Pros. higher success rate on average ablation has a 70 to 8% success rate. Low risk of complications, fewer than 5% of patients develop any problems. With recovery, it provides improvement in the quality of life, advance in catheter technology, imaging, and mapping techniques have improved success rates for ablation. And cons, well, repeat procedure for 20 to 30% of patients. The first ablation doesn't work and they have to go back for another. Sometimes medication is still needed. Ablations can sometimes even cause new arrhythmias. An ablation close to a coronary artery poses a risk of acute coronary occlusions and should be avoided. Watch a video.
Hi, I'm Dr. Richard Hongo, and I'm a cardiac electrophysiologist. Today we're here at California Pacific Medical Center, which is in San Francisco. This is one of our dedicated electrophysiology labs where we're very fortunate to have cutting-edge technology that allows us to perform complex catheter ablation procedures, such as ventricular tachycardia ablation. Now, as you may know, cardiac electrophysiology is a subspecialty of cardiology that deals with all different types of heart rhythm problems. Ventricular tachycardia is one of those problems, and it is very important primarily because it can be life-threatening. Now, there are many therapies out there for ventricular tachycardia. Some of them include medications that suppress the heart rhythm problem. Others include implantable devices such as defibrillators, which then monitor and at times need to shock patients out of the rhythm into sinus rhythm or normal rhythm. Ventricular tachycardia catheter ablation is a very important tool in the management of this rhythm problem because it allows us to actually find the problem and eliminate the focus that is causing the rhythm disturbance, and many times really help in controlling someone's rhythm alongside things like the medications or the implantable devices. Today, in this video, I would like to explain how catheter ablation is used to treat ventricular tachycardia. Let me explain by looking at the normal heart rhythm for a minute. When you think about the heart is essentially a pump. It's a pump that circulates the blood through the rest of the body. But if you take a closer look at the way the heart is made up, you can notice that there are multiple chambers within the heart. The top two chambers are the atria. The bottom two chambers are the ventricle. And the way the electrical activity actually organizes the contraction of the heart is through a very complex electrical wiring system. The activation starts in the top of the heart, up here in the sinus node, and it travels through the electrical system from top to bottom. And you can see the yellow colored electrical system here on this diagram. Another very important function of the electrical system, other than synchronizing or coordinating the heart, is making sure the heart doesn't go too fast. And that's primarily done through this portion of the heart called the AV node. This keeps the rhythm from never going so fast that the heart would degenerate. Tachy means fast. Ventricular tachycardia is essentially a fast heart rhythm or tachycardia that occurs from the ventricles, the lower chambers down here. And the reason why this rhythm is so concerning is because the rhythm happens outside of the normal electrical wiring system. So it is no longer regulated. The rhythm can degenerate and it can go so fast that it actually can become what we call a cardiac arrest. And this, as you may know, is a life-threatening condition.
Well, issue in Ecuador. There are only a few health facilities in Ecuador that offer this procedure. However, it has been possible to notice improvement in patients. In Guayaquil, the cost of cardiac ablation goes around 30,000. And finally, conclusions. Catheter ablation is the best option for patients that have ventricular arrhythmias. risks are low, and then percentage that the procedure will be successful is really high. Well, thank you.